Welcome back to Ronnie, I'm Joe B. Today we'll go over the muscles stretched when you do a 90-90 hip stretch. Let's dive in. A 90-90 hip stretch is a closed chain stretching exercise that undoubtedly improves lower extremity flexibility. You can progress to this exercise theoretically around weeks 7 to 9 of ACL rehabilitation, quad or patellar tendon repair, and meniscal surgery unless the pain is amplified when assuming the stretch position. To perform the 90-90 hip stretch, first, sit on the ground with hips, knees, and ankles at right angles. Position one leg in front and one leg behind you. Second, position your hands on either side of your front externally rotated leg. Third, actively stretch your front leg down into the ground by contracting the gluteal muscle of the front leg. Fourth, actively use your hip flexor to pull your torso over your front leg while maintaining a neutral spine. Repeat on the opposite side for 30 seconds hold, 3 reps each. The primary muscles stretched in the front leg include the posterior and inferior hip capsular ligaments, gluteus maximus, and piriformis. The secondary muscles stretched in the back leg include the gemellus superior and inferior, obturator externus, and quadratus femoris. So do you want to know the muscles activated during a single leg squat? If so, then watch this next video. Thank you so much.